All right, well, welcome everyone. My name is Katie and I work at the Sacramento Public Library, where books are just the beginning. And September is Healthy Aging Month, and we will be featuring programs throughout the month to help you improve your overall well-being as you age. I'm going to be putting a link to our website in the chat, which lists all of the Healthy Aging Month programs that will be happening. So make sure to check that out. I'll pop that over there in just a moment. And today we're excited to offer you Introduction to Medicare, presented by HICAP Services of Northern California. Before we get started, I wanted to mention a few things. First is, if you would like to ask a question at any point during the presentation, please feel free to use the chat function, which you'll find at the bottom of your screen. You can go ahead and type it in there, and then we'll address the questions throughout the presentation. If you're having any audio related issues, please exit the program and re-enter. Typically, we find that doing this will solve the problem. Also, if you need closed captioning, please click the live transcript button, which you'll also find at the bottom of your screen. Also, today's program will be recorded and uploaded to our YouTube channel, which is under Sacramento Public Library, and it will be available within the week, so you can look for it there. Finally, I'll be sending an email to all participants following today's program with links to any resources mentioned, along with the schedule of events for Healthy Aging Month. So keep an eye out for that. So let's go ahead and get started. With us today is Carolyn Washington, Education Outreach Coordinator at HICAP Services. Thank you so much for being with us, Carolyn, and providing this helpful information, and please take it away. Oh, and you're muted, Carolyn. There you go.
Thank you so much. This is such a great opportunity. I've participated with the library in another event similar to this, and it was in person, of course, but I'm so glad that we're able to kind of reconnect with this. So first things first, I am the Education and Outreach Coordinator for HICAP, but also I am the volunteer coordinator. And so with that, I have the awesome opportunity to work with all of our volunteers and all of the counties that we serve. So I'll be talking about the 9 counties that we serve in Sacramento, but then also giving a wide range of information about Medicare. So for the record, this information is dense. It is a lot of great information for folks who are on Medicare already, for people who are first timers coming out the gate, for people who may be care providers for individuals who are on Medicare, and also for people who are on Medicare and Medi-Cal at the same time, people who are maybe leaving covered California and coming to Medicare. It is a wide range of comprehensive information, and the good news is you don't have to worry about taking any notes. I'm going to make this presentation available for folks to have to look through after the presentation, but with one caveat. The end of the fiscal year for Medicare is coming to a close. And what that means is 2021 is ending and brand new things are going to be happening for 2021. This is traditional. Medicare's open enrollment will start October 15th and run through, and we'll talk a little bit more about that. The important thing to know is that this information is good for right now. So don't think that, oh my golly, I can utilize this for next year. If you want more information for how to prepare for 2022, you can contact us and we'd be more than happy to help out with that. So with that being said, first, I would like to, before we dive into this, I like the fact that Brenda Russell, she had her age kind of mixed up, but I'm glad she realized that. I'm glad you realized that you're 64, but absolutely there's some things that I can address in terms of people moving outside of the state and what to kind of think about in terms of that situation. Are there any other questions that are pertinent right now that you're like, I really would like to have maybe this question answered during the presentation? You can go ahead and put that in the chat, or you can unmute yourself and ask it now. The other thing is, if I could kind of get a sense of the folks that are online now, can you give me an idea of if you're on Medicare right now, or if you are about to start Medicare? So take a minute right now and kind of either unmute yourself to let me know. Okay, here we go. I'm enrolled in Part A and B on time, but could not keep up my Part B payments during COVID, lockdown, unemployment. What are my options now, please? Thank you. Okay, great. I got it. Anybody else? Okay, currently on Medicare, parents looking into Medicare. All right. Yes, enrolled began September 1st. Okay, all right, me and you, same thing. I am September 1st also. All right, good to know. Keep them coming. I can kind of review through the chats also as they come in. This presentation, because the information is so dense, I'm going to check in with you periodically to get an idea of if you are comprehending the information or you have questions throughout. So Katie, let's go ahead and get started with the PowerPoint. All right, here we go. So this presentation, all of the information to kind of get you started with Medicare or to help you throughout your journey through your Medicare experience is all through a help of this book. The Medicare and You book for 2021 is out now. Unfortunately, so many folks weren't able to get it. And so this book right here is your great place to start and a great resource for you. So most people, when they start Medicare, or even while they're on Medicare, they become pretty overwhelmed. I mean, right from the beginning, there are so many things to consider. Should you pick up Medicare? When should you pick it up? How many enrollment periods are there? There's so many things, and the anxiety that is attached to starting Medicare sometimes causes folks to maybe not enroll on time, or just feel so overwhelmed that they say, you know what, I'll just keep everything the same. I won't make any changes, and then again, suffer some consequences. So this presentation is really all about HICAP assisting folks in integrating Medicare into their life. A lot of times when people are putting healthcare plans together, they are really thinking about cost and a number of other things, and they don't realize that healthcare plans, Medicare healthcare plans specifically, are designed to allow you to adapt a plan that's going to be right for your lifestyle. So the objective of this presentation is stated here. I'm going to give you a pretty good overview of who we are, HICAP, the agency, and our parent organization, Legal Services in Northern California. I'm going to talk about all parts of Medicare, A, B, C, and D, the penalties, of course. And then I'm going to provide you with some great information on the number of enrollment periods that are relative to you. And then I'm going to give you this great checklist to keep you abreast, because every single year you should be making adjustments to your healthcare plan. And then I'm going to talk about something very important, and that's Medicare fraud. All right. So when folks initially get introduced to the fact that, great, I got this Medicare insurance, and I am going to be able to apply it once I'm this certain age. And folks think that their health care plan as it relates to Medicare is very similar to maybe the health care plan they had when they were working. And Medicare is completely different. It's completely different. And so often the answers that folks have about Medicare, they always end in, it depends. And so my first question is, what is the difference between a insurance company and a healthcare plan? Anybody know? All right, no guesses. So often when we are counseling an individual on their health care and we say, okay, so what kind of a healthcare plan do you have? They will undoubtedly say, I have Blue Shield, or I have Aetna. And unfortunately, that is not their plan. That is the company that's providing them the health care benefits. And so the education a lot of times starts right there. Then, of course, the question is, well, how do I then pursue a healthcare company, and how do I pick out the plan that's going to be right for me? So often, a lot of times people don't understand that Social Security and Medicare are two very different entities. Do they talk to one another? Not often. Social Security offices always refer their clients to HICAP because they focus primarily on Social Security. Social Security does play a role with Medicare, but it is not the provider. Who's eligible for Medicare? Anybody know? Who are the folks that are eligible for Medicare? So individuals who are 65 and older, but there are other folks that are also eligible, and we'll talk about that. If you're still working, how do you coordinate your employee benefits with Medicare? All of these questions are, the answers to all of these questions have a great deal to do with how you set your Medicare healthcare plan and your benefits up. The last question, can you believe the Medicare ads that are on TV? And do you qualify for all of them? And the big answer for that is, I'm going to say, unless you can read that very fine print, I would say they're all questionable. Even Joe Namath, the Medicare ads that are on TV are very specific and designed for zip code areas. And they're very specific when it comes to qualifying for them. And we'll talk more about that. So what about these penalties? How do you avoid becoming subject to penalties when you're on Medicare? Folks who decide, well, you know what, I'm healthy, I don't really need to pick up Medicare, and they wait and they don't enroll. And then when they do decide, maybe it's been 5 years, they think, I might want to pick up something, I'm having a few issues, and then they get this penalty. Why is that? We're going to talk about that and I'll explain why. Next. So navigating the Medicare system, can be confusing, but the good news is that agencies like ours, the SHIP, HICAP programs, are designed to help you throughout and with every circumstance that you come up with, navigate the Medicare system. How much is this service? Absolutely free. Our parent organization, Legal Services in Northern California, they provide us with all of these other additional resources to provide our clients with other issues, but primarily HICAP, the Health Insurance Counseling and Advocacy Program, is designed specifically to help people navigate the Medicare system, not just through open enrollment, but throughout the entire year. Why is that? Well, because your circumstances, when they change, your healthcare plan needs to change with that. HICAP is offered through every single county in the entire United States. There's a HICAP provided. I think Brenda mentioned she's moving to Arizona. There are HICAPs there also. Every single zip code area applies and has benefits relative to their community. And I'll talk more about that. And so HICAPs are designed to help you really understand what benefits and what plans and what companies are available specifically to wherever you live. So I asked the question, who do we serve? Who's eligible? Folks who are 65, of course. People who are imminent of becoming 65 or older, people who are disabled, individuals who are either receiving Social Security or SSI. Those folks are eligible, excuse me, for Medicare. Our HICAP in Sacramento, it's our main office. We serve 9 counties throughout the region. We're the largest HICAP in California. And prior to the pandemic, we would provide one-on-one counseling where folks would come into one of our counseling sites, receive face-to-face counseling sessions, and this would occur at any point of your Medicare experience. Now, of course, unfortunately, a lot of our sites are not open with the new Delta variant coming back and causing a lot of the sites to maybe reconsider opening. We have now been committed to providing all of our counseling services over the phone. Some of our sites have decided to open. They've given us space to provide counseling sessions, but it all depends on our volunteers. We have staff that's actually paid. And then we also have about 50 volunteers that provide the direct service. The great thing about our volunteers is that they are all certified. They've been registered by the California Department of Aging. And when I say they've gone through a rigorous training to become a volunteer, they also have trainings every other month on all of the updates that Medicare implements. How often does Medicare make changes? Regularly, especially now during the pandemic, it's even more so. All right, all of the services that we provide are listed there. The ones that are pretty important right now, the basic ones, A, B, and C, but when it gets into TRICARE for Life, long-term care insurance, we also provide counseling around those issues. Here, I think our focus and our mission is all about advocacy. Our intention is to provide individuals with enough information to get them through a situation, but to also provide them with a great deal of information so that they become great advocates for themselves. There have been a couple of studies that have been done, and the question was, who in the hospital, if you have a hospital experience, which individual gets the best care? And to my surprise, it wasn't the person who paid, $1,000 a month for their premium or had, a company that had star ratings. It was the person who had a great advocate with them or were able to advocate for themselves. And so our commitment is to help you become a great advocate, if not only for yourself, but for someone else also. We also will provide you with any legal representation to do appeals and grievance. No guarantees, but the service is there. We have a attorney that's on staff that assists with these kinds of issues, but then also we utilize legal services to assist with issues that maybe are related to bill collection, or maybe you have a complaint about your physician. All of these kinds of issues can be dealt with through our agency also. And again, all for free. That's our direct information. You can contact me, or you can contact our office directly to make a counseling appointment with anybody in all of the counties that we serve. If you're outside of our county, we can also provide you with information about the HICAP in your area. Or for if you go into Arizona, we can contact the HICAP there, give you that information, and you can have assistance prior to you moving, which is a great thing that you're asking that question, because a lot of people move and think that they could take the insurance that they have and apply it where they're moving to. It absolutely doesn't work like that. Next slide. All right, this is where it all starts. California, unique to all of the other states. Every state has their approach to how they implement Medicare, Medi-Cal, different insurance plans. There's 61,000 people, and 6 million of those folks in California are on Medicare. Each one of those individuals has a different Medicare plan. Very unlike what most people think. They think that they can go to their cousin, their sister, their husband and say, hey, your Medicare plan is the one I want. And it absolutely doesn't work like that. Your Medicare plan is specifically designed for you and your healthcare needs. So it all starts with you paying into. If you were an individual who paid into your Americans' social safety net, into Medicare on a monthly basis through your paycheck. Next slide. There we go. So folks paid into Social Security and also Medicare. Now, some people did not. Railroad retirees, some school districts opted out of paying into Social Security and Medicare. And so the Medicare benefits for those folks, it's still accessible, but it's different. So if you paid in, you then now are eligible for this wonderful entitlement program. I remember when I first started working for HICAP, and I would get so much pushback on, let's get rid of these entitlement programs. Well, maybe not, because you paid into these on a regular basis to now be able to afford this benefit. Here's how you did it. With a percentage, your employer also paid in. But again, if you did not pay into Social Security and maybe at a later date decided, oh my gosh, I do want this benefit, you could have started paying in. Or even at retirement, if you realized, oh my gosh, I do not have enough quarters of contributing to Medicare, you can also start paying in to actually at some point pick up Medicare. Here is a diagram of kind of how Medicare is funded. We're going to skip through that. I put this in this presentation, so a lot of folks have a lot of questions about how Medicare is funded. And so you can look into this and kind of see some of this data is changing, but it's still very relative for folks who want to figure out, oh my gosh, is Medicare going to be here 5 years from now? One more. All right, so when you become eligible for Medicare, and as you approach this time, it is very important for you to relinquish these ideas that you have had about your employer coverage, or if you have been on Medi-Cal and now are becoming Medicare eligible. The unique thing about Medicare is that you are creating your own individual healthcare plan. What does it look like? How do you choose the right path? I'm going to, in the next slide, there are some specific things for you to consider. Most folks, again, automatically go to these wonderful ads on TV where they're like, oh, you got this $99 plan that's going to be great for you. Well, maybe, but maybe not. Your health currently, is it in good or average or poor state? What are your healthcare needs? Do you have a healthcare provider that you would like to keep? Just recently, I had a county employee. She was retiring. She found out that the county said, you know what, we're no longer going to be able to afford carrying the cost of your complete healthcare package. And now you're going to have to pay $975 a month. And she was like, I absolutely didn't plan for that. I would like to change. I'd like to leave my employer benefit and pick up Medicare. Well, she had a couple of things that she needed to consider. And one was she had health conditions. She had a heart specialist. She had also a lung specialist. The question was, how is she going to be able to keep these care providers to make sure that she remained with them even as she decided to make changes to her healthcare plan? Are you on some regular prescriptions? It's okay, go ahead. So here are some additional things. Are you going to need dental, vision, and hearing? What's your employment status? Are you going to do some part-time work? All of these things are first things first. And it's not only one time a year that you need to take these things into consideration. You want to look at these things each time you have a circumstance in your life that changes. Has your income changed drastically in the last couple of months? And if so, what other programs do you qualify for based on that? How can you get your premiums reduced through Social Security if you have had a income change, right? All of these things need to be considered because you can qualify for a special enrollment. You can leave one plan and go to another. So these are things that on a regular basis that you need to be paying attention to. As I mentioned, this book is going to be your best resource. A lot of times, individuals who are on Medicare will go through their book, pinch back a couple of pages, call us up, and just ask for clarification. I think that the book is not in, the medical terms or the terminology isn't so difficult that you cannot understand. But if you're not familiar with the terminology, we can kind of help walk you through the process. So here we go. Each person that is eligible for Medicare at any given time has this question to be answered. You can have the option of deciding, do you want to accept your healthcare benefits through Medicare through original Medicare, which is a particular pathway, or do you want to choose the Medicare Advantage pathway? These are two different ways to have all of your healthcare needs met through Medicare. The question is, should I sign up for what parts of Medicare do I need? Do I need all of them? And we're going to talk about each pathway to access your benefits to receive all of your healthcare services. We're going to start with original Medicare. So this diagram is in your book, and you'll see it a lot of times when you are being asked about how you accept your Medicare. A lot of healthcare providers, when you go to the doctor, they'll say, do you have original Medicare or Medicare Advantage? This is a question where you need to know the answer. Are you in an HMO or a PPO? This question, when you answer this question at any given time, it lets care providers know how you are accessing your benefits. Original Medicare says that you have all of your health care needs met through all parts of Medicare. So starting with original Medicare, you have Part A, which is hospitalization and a couple of other things. You also have Part B, which is your doctor visits, your durable medical equipment, preventive services. All of these are services under Part B. I'm going to skip C for now, and D, your drug prescription plan. For any individual who has original Medicare, they're having all of their healthcare needs met through these three parts. Part C is where you are combining all three of those pieces in one location, in an HMO or a PPO. So further explaining original Medicare, your hospitalization, inpatient hospital care, skilled nursing facilities, home health care, and hospice care. All of these costs, all of these services are taken care of with your Part A. This part of Medicare for most folks is premium free. There's no monthly premium associated to this. Why? Because over the lifetime of your work history, you either worked 10 years, you have earned at least 40 quarters. It doesn't matter how much you made during those periods, you have paid into it, and now you have this service, this benefit of Medicare completely free. So Brenda, how does Medicare dovetail with? So with long-term care, it all depends on the policy that you have. And so right now, the long-term care plans, I don't know who yours is from, but what you could do is you could make an appointment with one of our counselors, you bring in your long-term care plan, and it will have specifically how your long-term care plan complements with your Medicare benefits. It will determine who's the first payer, if you have a hospital event, or if you have a, how it connects with your doctor, or how you, if you go to long-term care yourself, how your long-term care plan will cover it. I want to really urge you to dive into your long-term care plan, because there have been a number of them who are changing their benefits, and also a number of them, the face value of them have changed, and folks are very surprised when it comes time to utilizing those long-term plans. I hope that answers your question. So if you've earned the 40 credits, the 40 quarters, you then, Brenda, CalPERS, yeah, it is changing, absolutely. CalPERS, they just submitted we've gotten a huge PowerPoint just here recently, and a lot of updated information. I know that there are some lawsuits that are in effect right now, so I would really encourage you. Our counselors just have gone through a long-term care training to address this issue, so I really want to encourage you to contact us about it. So if you have earned enough quarters, you do have this Part A premium free, but if you have not, unfortunately, if you have less than 30, between 30 and 39 quarters, you are going to pay $259 per month for your Medicare Part A. If you have less than 30 quarters, the premium goes up substantially, and you're going to be paying $471. That's hefty. If you want to earn more quarters after you turn 65, you can still do that, and at some point then acquire Part A, hospitalization, and all those other benefits premium free. All right, should you get Part A? Always a question for folks. This is the answer for people who, if they remain employed, if their employer has fewer than 20 employees, it's pretty straightforward. If you are considering to delay Part A for any reason, because maybe you are healthy and figure you don't need it, most people just go ahead and pick it up because it's premium free. But if for any reason you decide not to, some folks may be subject to a penalty, but there is also a Part A deductible. You only pay this deductible if you have a hospital stay. This is a one-time payment. You don't pay it up front. It's normally billed to you, but it is significant to being admitted into the hospital, okay? This is very unique to being admitted into the hospital. Go ahead. So if by chance you do have a hospital stay and then you do end up going into some long-term care afterwards or skilled nursing facility, there are some other deductibles that are associated, and you can kind of check that out. Here is if, again, you decide to not pick up Part A and you wait 5 years and you say, you know what, I'm going to go ahead and pick up it, but you were eligible when you turned 65 but didn't get it, there is a small penalty. Fortunately, this penalty does not go through the lifetime of your journey on Medicare. It's a short-term penalty, and then you are allowed to pay to either go back to no premium at all, or if you are paying a premium, your premium costs will drop because you have met the premium threshold. Part B, again, we're still talking about original Medicare. This is a part of Medicare that is premium driven. So let's say that you have Part A and you have Part B. You've had a hospital experience, you paid the deductible, you get out of the hospital, you don't have a skilled nursing facility stay, you go home, but you have to visit the doctor, or you have some clinical lab tests that you have to take, and maybe you need a cane or a wheelchair. All of these costs are going to be taken care of through Medicare Part B. There is a premium for this. There are, wonderfully enough, through the Affordable Care Act, there was a provision in the Affordable Care Act that provided Medicare beneficiaries with a host of preventive services. This means that you can go to the doctor and have all of these tests that used to cost Medicare beneficiaries. No longer. They're no longer going to be subject to these costs, so you can get a bunch of different tests to help prevent you from becoming ill. And I've given you a list of a couple of them, so you can flip through these next 2 slides. So during this period, this unique period that we are in, Medicare has tried to keep abreast of how they can adapt their benefits and their coverage to reflect the services that Medicare beneficiaries will need. The main thing is around telehealth, of course, lab tests. Will we receive? Yes, you will receive this PowerPoint presentation. All of these costs that have been associated to the pandemic and COVID, these costs are being assumed by Medicare. I just had our receptionist went to a pharmacist and not a pharmacist, they went to a urgent care, and the urgent care told her that she would have to pay $250 for a COVID test. That is absolutely untrue, should not be happening. But again, Medicare has adapted to a lot of the circumstances. And so if you have any questions about costs that are associated to the pandemic, you can contact us and we can update you on any of the costs that you absolutely should not be occurring. You can, who's this, Becky? You can contact their, Katie can provide you with all of the contact information, and she's going to provide you with a couple of resources at the end of the presentation, and you can call our office directly and set up an appointment with a counselor. And in the request, when you are making the appointment, you absolutely want to say that it's time sensitive and it's related to CalPERS and long-term care, because we have specific counselors who deal with that. I will send an email. Yeah. All right. Thanks, Katie. Okay. So healthcare reminders. So there are opportunities for folks who have been either affected by the pandemic, folks who have been affected by the fires, folks that have been affected by flooding throughout the country. And wonderfully enough, Medicare makes these provisions to allow folks to qualify for special enrollment periods, all related to life-changing circumstances. Or if you yourself, you were working, you lost your, okay, I'll answer that question in just a second. You lost your employment, or you had an accident. A lot of times you then can qualify for a special enrollment period. So pop that question back up there again in the chat. Where did it go? Is there a penalty to join Part B or C as you have PT but still covered by husband's work? So didn't sign up yet. Thanks. So, okay, there is a penalty. There can be a penalty for signing up for Part B and C, but it all depends. It depends if you are working. It depends on if your husband is working and you're receiving benefits. So if you want to take my information down, you can give me a call and I can get further into that question based on your personal circumstance. So the big question, vision, dental, and hearing. These benefits traditionally through original Medicare have not been covered, but there are some circumstances where it can be covered, right? Folks who have original Medicare, which means they are separately acquiring Part A and Part B separately, they can pick up dental, vision, and hearing through other carriers that provide these benefits for Medicare beneficiaries. Medicare Advantage plans also in 2021 started offering extra benefits to Medicare beneficiaries. So there are situations where Medicare beneficiaries can pick up vision, hearing, and dental. Still talking about original Medicare, Part B premium is $148.50. This premium changes every year. It fluctuates according to the COLA. If people receive a cost of living increase, normally the increase would also be attached to the Part B premium. Most people pay this premium through Social Security. This premium is driven by your income. If your income is higher than what is approved through Medicare, then your premium cost will go up, but most people are paying $148. Individuals who in their retirement are receiving income greater than $88,000, they are going to have a higher premium cost. This will vary all the way up to, you can see, $504. This chart, these increases do change every year. And so 2021, 2022, you'll be looking at some different numbers. So a lot of times we have October 15th coming up. Unfortunately, we do not get all of the updated information because it's plan and insurance company driven. We don't get that information sometimes any earlier than October 10th. And so Medicare has a link on their website, medicare.gov. It has a link on their website that can allow you to calculate your own Part B premium. It asks these basic questions of you, and then it'll produce for you what your premium cost should be. So there is a deductible, and how your deductible, is there additional Part B premium only charge paid for once a year? Yes, your Part B, wait, let me see that again. Let me see that question again. Is there a penalty to join? No. Is the additional Part B premium only charge paid? No. This premium is monthly. That $148 is a monthly premium, not a yearly. The deductible is yearly. So what happens is folks who turn on their Part B, they are paying their $148. The very first visit that they have with their physician, if they only have Part B and Part A, they go to their physician for a doctor's visit, and the doctor will say, the receptionist will say, oh, you have a $203 deductible. Your visit today is $75. That $75 will be subtracted from that $203. And as you meet this deductible, whenever that happens, then the rest of your visits are free. You may have a copay. Next slide. Here we go. So there is unfortunately a late penalty enrollment for Part B. This one is a little different than the penalty for Part A. How Medicare works is that those 6 million people that I said in California that are paying into Medicare, as long as all of the people who are eligible for Medicare are paying this premium, the premium stays low, right? For example, if half of the folks who are eligible for Medicare decided not to turn on or pay into Medicare, the premium normally would go up, but Medicare said, no, we're going to leave the premium the same. When those folks decide to come on board, they'll be paying this late penalty, right? The difference with this penalty, if you are eligible at 65, you don't turn it on, you wait 5 years to turn it on, there's a 10% increase for every 12 months you delayed. If you turned it on and then had this delay, I think that there was a question in here, you had a delay, you could not pay, you were dropped, and then you decided to pick it up, whatever period of time you did not have the Part B coverage, you will then also be subject to a penalty, and it will be prorated based on the number of months you did not have it. Unfortunately, with this particular premium, if you are subject to a penalty, your higher amount of that penalty will then be it will then be attached to your premium for the rest of the time that you are on Medicare. It's very important that at all costs that you try to stay current with your Part B premium, unless it is unavoidable. And if your income does drop to a period where you can then be qualified for other programs, there are Medicare savings programs that you may qualify during a hardship period. We can provide you with information that can help you determine how to address the situation of possibly being alleviated from paying any enrollment penalties. So what was the question? Even if I'm covered by husband's insurance and don't join Part B, can you repeat? Part B penalty, sure. Let's go back. All right, so let's say that you are Medicare eligible, you have Part A, you decide I don't want to turn on my Part B. I will just, if I go to the doctor, I'll go to urgent care and I'll just pay. And let's say you do that for 5 years. But then you decide, you know what, 140, let's say it's $148. I have that. I'm going to go ahead and pick up my Part B. But it's been 5 years. They are going to say every 12 months that you didn't have it, so that would be 50%, 10% every year. You missed it for 5 years, that's going to be 50%. Your premium is not going to be 148, it's going to be 50% higher than that. Make sense? Okay. It doesn't make sense. Okay, let's go. Let's try it again then. So, can you unmute and tell me the part that's not making sense to you? That'll help me out.
Can you hear me?
I can hear you.
Oh, okay. Yeah, I'm covered by my husband's insurance right
Sure.
now, Part A and B, but I went ahead when I was 65 and signed up for Part A.
Wonderful.
But they told me not to sign up for Part B because I'm already covered by my husband's insurance.
Right.
But he's retiring in 6 months, and now I'm 72 and I'll be 73 in January. So it's been 5 years exactly. It'll be 6 years in January.
So I'm sorry, I didn't mean to interrupt you.
No, no problem.
You are good because your husband's insurance, the health plan that he has, was associated to him working. Is that correct?
Correct.
So this is health benefits as it relates to a employed person and not a retired person. And so that coverage is considered, credible coverage. And so when you go to sign up, you will receive a letter from your husband's employer to say you have had credible coverage.
Okay, so when he retires, what is the time frame before he retires that we need to get this Part B, locked up, so we don't have these ridiculous penalties?
You have 8 months.
Okay, yeah. After he retires, we have 8 months.
Yeah,
to sign up for Part B, C, whatever.
And you can do it before,
Okay.
You can do it before. Absolutely. Because you don't want to have a gap in service.
Oh, that's great.
Right.
And I have some specific questions about specific plans, but I don't want to take your time or other people. Is it okay if I call you?
Absolutely. Okay. Absolutely. Yeah.
At the 375-3765?
Yes. And if you call there, you'll leave a message. And so why don't I'll give you my email and you can email me directly and then you and I can talk directly.
Okay. Sounds good.
All right. Thank you.
Okay. Thank you.
Yeah.
This has been very helpful, by the way.
I'm glad. That's exactly what it's supposed to be. All righty. So always the question for folks, not just during open enrollment, is should I sign up for Part A? Should I sign up for Part B? And it always, the question is, it depends. You know, what are your healthcare needs? Are you going to be living in the area? When I'm counseling with any individual, I never ever start with, well, what healthcare plan would you like? You know, there are always these questions about what is your current situation. If I find out that you live in Yolo County, I have to then go to all of the plans that are available in Yolo County that are specific to you and your needs. You may have a specialist that is in Stanford. Well, now automatically, you don't want a plan that is only for Yolo County. You want something that is going to enable you to have the flexibility to go wherever you want and keep this physician that's at Stanford. All right, so we've talked about Part A, we've talked about Part B. The other thing that an individual is going to need is a drug prescription plan. Again, we're still talking about original Medicare. These are folks who have chosen this pathway and chosen to do a fee for service for all of their healthcare needs. These plans are specific. This path is specific to people who are Medicare eligible. There are a number of prescription drug plans out there. You can buy a standalone one. You can get one through Medicare Advantage, but primarily you can get a plan as low as $7 or one as $130 or even higher, but it all depends on your prescription, your drug prescription need. You may pick a $7 plan because you think, oh, that's fantastic. And then when you go to the pharmacy, you find out, oh my gosh, this plan doesn't provide me with the medications that I need. Every plan has a completely different list of medications on their formulary, and the formulary changes regularly. You can have a drug on the formulary that costs $19 one month, and then the next month, the medication could be $300. If that happens to you, what do you do? Do you stick with it? Are you like, oh my gosh, my plan? No, at that point, you can contact us and we can schedule you for a special enrollment because the plan has made this drastic change, right? And the plan is supposed to be able to still provide you with that medication until you can find another plan. Do most folks know these things? Absolutely not. So with the Part D, there is this thing, the donut hole. A lot of people, I mean, and why they chose to call it a donut hole, it's they took a perfectly good dessert and made it an interesting thing. So this donut hole is directly related to the amount of money a healthcare, a drug prescription plan provides you for drug cost. So if you purchase a Part D drug prescription plan, it is going to provide you a certain amount of money towards medication. $4,130. Once you reach that threshold, they say you have fallen now into the donut hole. What that means is your medication cost now is going to be partially your responsibility and also the plan's responsibility. Prior to that, your plan would be paying, but once you reach that $4,000 benchmark, it's now part of your responsibility. Now, for some, they're like, I'm never going to spend $4,000 on medication, but for others, unfortunately, in America, what do you think the number of medications an individual is taking who's over 65? How many medications are they on? Anybody know? Give me a number. Just throw a number out there, anybody. 5. Okay, good job, Katie. 4, 6. Unfortunately, it is 8 to 12. 8 to 12 medications. And unfortunately, some of the medications start at $1,000. You can already see that that individual is going to get to $4,000 pretty quick. And once they are in the donut hole, they are going to now be responsible for part of that. Once they have spent up to $6,000, they say you're at a catastrophic state and now you pay a very small amount for the medication. But if you never get to that $6,000 mark, you're going to be paying. This donut hole was supposed to disappear back in 2019. Unfortunately, this thing has become very complicated. We can assist with that. And there are some things that are in place to assist people with covering the cost of their prescription drugs. So should you pick up a Part D? Should you not? Again, it really, really depends on your need. If you are receiving benefits from your former employer, or if you are employed and you are receiving benefits, this particular part of Medicare is where some folks get tripped up. They think that it might be to their advantage to, what do they say? Oh, they want to get double the coverage, you know? It's like, oh, what would it hurt, you know, if I get this plan or if I use my husband's and then buy another one? Absolutely do not. If you are receiving healthcare benefits from your employer and they're covering and you sign up for a Part D, they will possibly kick you off of their insurance and you will not be able to pick it back up. So this is a very important piece. I mentioned the credible coverage. If you are receiving coverage from your spouse and they're working, you have credible coverage and you will not be subject to picking up a Part D or subject to any penalties. So here is the part of Medicare relative to your prescription drug plan that provides you with extra help. A number of folks, if they fall into this income bracket, they qualify for extra help, and this is a great way to get your prescription drug cost taken care of. In addition, folks who are on Medicare, they do not have to be on Medi-Cal, but if you go to your pharmacist and you say, okay, I would like to pay whatever the cost of this medication is, I would like to pay what a Medi-Cal beneficiary would pay, the pharmacy has to provide you with that cost. A lot of folks do not know that. And a lot of times the pharmacy will not know. If you go online and you look at prescription drug cost for Medicare beneficiaries, you'll see some information regarding how you can reduce the cost of your drug prescriptions. There is this penalty associated to the Part D. If you have not enrolled in it, there's a small penalty, and some people are like, you know what, I'm not going to pick it up. I'm going to use RX drug, or I'm going to figure out some kind of way to get my medication because I'm not, you know, I'm pretty healthy. If they do decide to pick it up, it's just a 1% increase in your premium cost for a late enrollment for your Part D. Again, we're still talking about original Medicare, and folks who have Part A, Part B, and Part D, that deductible and also co-pays and maybe some supplemental coverage, they will pick up one of these supplemental plans. They are only related to original Medicare. This has become a little confusing in 2021. The Medicare Advantage plan started using the term supplemental, and it used to be only used as it was associated to original Medicare. So be very, very careful if you have a Medicare Advantage plan and someone says, hey, I want to sell you one of these Medigaps, one of these Medicare supplemental plans. That is illegal. You do not need it. It cannot be utilized in a Medicare Advantage plan. These Medigaps are only associated to people who have decided to use original Medicare as their pathway. There are a range of them. They go from Plan A all the way to Plan N. And you notice I am using the word plan and not part. This is an additional part of Medicare that is optional. All of it is optional, A, B, and D. You can pick it up or not. There's no penalty if you decide not to pick up one of these plans, but folks like to add this to their original Medicare pathway because it's going to offer you these benefits that are on the left-hand side. So you go to your doctor's office, you pull out your Medicare card. It has on there that you have original Medicare Part B. Your doctor visit is taken care of. You pay a they say, well, you have a deductible and you have a copay. You pull out one of these plans, A, B, or C, or D. You pull this card out and all of your co-insurance, your Part B co-insurance or your copay, these things will be taken care of with a Medigap. So how do they work? They are the supplement to your Part A, B, and D. You're optional. You don't have to pick it up. You do have to have Part A and Part B to even qualify to pick up one of these Medigaps, though. There have been some big changes to these Medigaps starting in 2000, and it's so very important that if you think, you know what, I would like to pick up one of these, when you originally become eligible for Medicare, that is considered your initial enrollment into a Medigap. The beauty of that is you can sign up for one of these even if you have some pre-existing conditions. That is a big help because at 65, a lot of folks already have had some issue, but none of these plans can deny you. Once you passed your initial enrollment period and now you're on Medicare, if you decide that you want one of these supplements, one of these Medigaps, you would then contact the plan, let them give you your options of plans that you can select from, and then you have to qualify. They can deny you if they'd like. I'm finding that more of the plans, more of the Medigaps are accepting people, even if they have some pre-existing, but at that point, it's up to the plan. Now, once you have it, every year at your birthday in the state of California only, you then can decide to get a different Medigap, stick with the one you have. You can always get a better Medigap, but you can't get a Medigap plan that has less benefits. The Medigap also this year changed. It used to pay your deductible. Plan C and Plan F were huge in terms of so many beneficiaries liked those plans because instead of having the deductible for your Part A when you had a hospital visit or your deductible for Part B, they took care of it. Somehow the Medigap said, you know what, we want the beneficiaries to have some skin in the game, so they took that out. Who knows, they may be bringing it back in 22, but we'll have to see. The California Department of Insurance is the managing body for these Medigaps. If you want to look at a range of Medigaps and the comparisons of them, this is the great place to go to kind of get an idea. How are we doing on time? Okay, all right. All right, so we've talked completely about original Medicare. We're going to bump into Medicare Advantage. This is the opportunity. No, go ahead, you're fine. This is the opportunity for folks to get a bundle. All of the parts of Medicare, A, B, and D in one location. For our area, the best example in terms of just as an example is Kaiser. Kaiser is a unique HMO that has all of your healthcare needs provided at one location. Some people love it. You know, they're like, oh my gosh, I've been with this type of plan forever. I like the one-stop shop. It works out great for me. And other people are like, I don't know. I don't know, it's good, but they have these things called protocols. Anybody know anything about the protocols that are associated to HMOs and PPOs? So, not knowing this is very important. So, yes, Beverly, tell me what you know about protocols. You're gonna mute yourself. You can unmute yourself at the bottom. There you go.
Okay, can you hear me?
I can hear you great. Thank you.
So what I'm aware of is that there is a prescribed process and prescribed procedures for everything, or for most things rather.
No,
so,
for everything.
Okay, okay. So when you go in and you present a medical concern, there is like a chart, a checklist of processes that they go through. So you can go in and say, you know, I've got this bruise on my hip that won't go away, and I'd really like to have an X-ray taken or an MRI. And at Kaiser, and I have Kaiser, and I really appreciate them, but they have a process. Then they do not generally deviate from it, no matter what your extenuating circumstances are. And people get really frustrated by that, particularly, and rightfully so, if they have a concern like they suspect they might have cancer, or they came up with a different element of their existing condition, and they think that it justifies having a series of blood tests or whatever, and the doctor says, no, you know, this is what we're going to do. And they feel like they're being put off, they feel like they're being discounted, they feel like they're being ignored, and they feel like Kaiser is on the cheap and they just won't do it because they're trying to save money. So that's what I know about it.
Yay, Beverly, that was awesome. That was awesome.
Thank you.
That was awesome. So yeah, these protocols, I'm going to dip a little bit more into that. And the beauty of HICAP is that I can provide this information to you with unbiased. I can speak directly to these situations because I have the great opportunity to talk to more than 400 plus people who have chosen either of these options. And for you, the important thing is to find the option that's going to be best for you. So I have no bias about it, but I do know these circumstances. So Beverly is absolutely right. The protocols that exist in the HMOs and PPOs, the thing that I like to remind people about these protocols, is that the HMOs, these networks, put these protocols in place. They say it's for risk management. So what Beverly was saying, that I don't care who you are, if you get to a network and you say, I have this shoulder situation, they don't care what your circumstances were prior. They have a set state, a set standard of protocols that they have to put you through. They, may give you medication first. They may then give you therapy. They may then give you acupuncture. I mean, and every single person that comes in has to go through the same protocol. They say that, again, it's risk management so that if, out of the 5,000 members that they have, they don't want one member saying, well, you treated this person like this and you didn't treat me in the same way. Well, that can work for some, but if you do come in with a special condition and you're like, and it's time sensitive, you want them to really get after it. And you say, well, can you just send me to a specialist? They say, no, you have to have gone through the protocol before we can refer you to another person, to a specialist. So there are some key things that have occurred with Medicare Advantage plans. I mentioned earlier that the term supplement has now been added to their arsenal of terms, and it's a good thing that they can provide dental, vision, and hearing, but you have to really take a good look at the plans that they are offering. Every year, the title and the number that's associated to the plan changes. And a lot of people don't know that, because when they were with their employer and the employer said, okay, it's open enrollment time, most people will say, I don't even want to look at all of these plans, just everything I had last year, just keep it the same. Well, even then, the plan numbers were changing. Your employer would just try to adapt to whatever you had last year to, accommodate. Well, with Medicare, you have to be paying attention, because these additional supplemental plans, they can cost and they can be subject to certain requirements. We have supplemental plans that are now offering transportation and pest control and club memberships and all of that. So you have to really kind of scrutinize what the plan is offering and the cost and where you can get these services. So there are 3 different types of supplemental benefits, and this is very important to the Advantage approach, because a number of folks will qualify for standard benefits that would include these vision, hearing, and dental, but then others may have some specific diseases that are relative to maybe needing some more special services, and they call those targeted supplements. And then they have chronic individuals who may have some chronic conditions. They then may qualify for additional benefits at a affordable premium cost. But again, you have to know that these things are in place. So in comparing original Medicare to Medicare Advantage, every year there is an agency that is connected to Medicare and also to analyze the cost associated to original Medicare and Medicare Advantage. A lot of folks, if I ask the question, hey, which one do you think is going to be more cost efficient for the beneficiary to pick up? Most folks would say Medicare Advantage. I think that because they see that some of the plans are 0 premium. And so they're thinking, no, I think that absolutely it's going to be more affordable. Well, actually, for the 3rd year running that they have been doing this assessment, the Medicare Advantage plans have cost the system and the individual a much greater cost than what was anticipated. You may have a 0 premium with a Medicare Advantage plan, But if you are an individual that goes to the doctor's office pretty regularly, or you have some unique condition that may require you to get services outside of your network, then your cost every month is going to increase. If you find out, oh my gosh, I have this rare condition and I need a specialist in Arizona, right? And you say, I found out that this person is great, I want to get this coverage. Well, your network says you're going to have to pay for that service on your own. Those costs have driven up the cost of Medicare Advantage. So when you are looking to choose which pathway to go and which one is going to be best for you, you need to really consider, again, all of those 11 questions that I had mentioned about things to consider before you choose, but then how important is choice to you? I have a number of folks who have been in the network system forever, their work history, but have realized that, you know what, I don't want to be subject to a gatekeeper. If I want to go to a specialist, I want to go right to the specialist without having to need a referral. If I find somebody in Vegas that I want to go to that physician because they online have shown some great results in whatever your condition is, and you just want to go there and you don't want to pay an out of pocket cost in addition to paying for your premiums, that pathway, Original Medicare, may be better for you. Now, if you choose 1 year to go Original Medicare and then you find, you know what, I think I want to go back to Medicare Advantage, you have that option. If you get into a Medicare Advantage plan and you go, it's not working for me, I cannot get the services that I need in my Advantage plan, you can opt out and get into a Original Medicare plan. All right, so if you are coordinating your benefits with your healthcare plan through an employer, that's me right now. I'm still working and I love the idea of being able to, if I needed to have the healthcare covered, my employer is they are not indicating that I cannot pick up parts of Medicare and still be covered under my healthcare plan. I have credible coverage. Everyone's circumstance is different. So I've given you a couple of questions. If you are still working or you're retired and going to receive benefits, these are some questions that you can ask the administrator of your healthcare plan in retirement, which is very different. A lot of people are like, oh, you know what? I'm still going to be getting benefits from my employer. I'm going to retire, but I'm still going to, the state workers this is very common. And they get ready to retire and they're like, oh, my plan is going to be the same. No, they have specific plans for people who are retired and at age 65 or disabled. And so you then need to start planning ahead whenever that time is approaching, where you are reading your handbook. Sometimes those handbooks can be pretty, difficult to interpret. You can bring your handbook in. A lot of them are now online. They don't provide you any hard copies of them any longer unless you request it. But we can get with you online, help you try to decipher what the healthcare plans look like. And then you can go to your administrator, get a really clear picture of the cost, because this is very important. CalPERS, CalSTRS, the county, school districts, all of those entities that offer employee or retirees healthcare plans coordinate with Medicare or not. You can opt out and say, you know what, my employer, what they're providing me now, I'm going to have to kick in $700 when I wasn't before. Maybe I can do better and get the exact same coverage with Medicare, and we can help you kind of determine what approach is going to be best for you. One more. All right, so we kind of talked about the two pathways to access your follow-up questions as retired state and Cal employees, even though I'll be landing in Arizona prior to. There's some more to that question. As retiree state, even though I'll be landing in Arizona prior to age 65, I still need to coordinate with CalPERS. Yes, yes, absolutely, absolutely. So enrollment, I'm laughing because this was tricky for me. I mean, here I am, the educator of folks needing navigation through the system, and Social Security would not relinquish my password. I mean, I spent weeks trying to access my, and I get it. I have many associates that are employees of Social Security, and they are extremely overwhelmed. And I could not enroll in Medicare because everyone now is needing a My Social Security account. I've had one since 2016. I signed up years ago, but for some reason, I just could not access it and couldn't enroll. Enrollment prior to the pandemic was a lot simpler. Normally, if you decided at 65 to also start taking your Social Security, you would automatically start receiving your Medicare. They would send you out a packet, they'd send you out a card, and you could determine to go online and enroll or step into a Social Security office. Well, next, that no longer is the option. All of the Social Security offices are closed. They're only taking phone calls. They're only allowing folks into the offices under extreme circumstances. And you would normally, when you were able to just go online and enroll, the automatic enrollment is it's lagging even more than 3 months. So my suggestion to folks who are about to enroll or who need to make changes to their Medicare, as soon as you know that that time is approaching or you have a circumstance, it's a great opportunity to call us. Fortunately, we have some backdoor. I have some folks that I can contact. Social Security is not giving out their phone numbers, so I can reach out to my contacts and kind of try to get support in navigating the situation. But for most people, 3 months before you turn 65, your birthday month and 3 months after is the window for you to sign up for Medicare. If you become disabled at your 25th month of you receiving disability, you now become eligible to sign up for Medicare. Just want to share that we're at, okay, great. So enrollment, let's go to the next slide. Enrollment opportunities, next slide. There are 5 opportunities for you to enroll in Medicare. Most folks have no idea. They think that the initial period is, you know, at your 65th birthday and that's it. You have the general, next slide. And you have these enrollment periods. I've talked a few times about the special enrollment period, and it varies. It really, I think, requires a call to us to see if you qualify. Then there are the 5-star special enrollment periods where if a company has 5 stars, that means they have an excellent rating. You can switch at any time into any of those plans. So Medicare enrollment tips, I've given you some things to consider when you're thinking about enrollment. It is optional, and fortunately, there are these Medicare savings programs. If you found that you have come upon a situation where you have lost income, or your income changed drastically from, yeah, I was a state worker and my salary was this, Social Security kind of connected my premiums to this income, but I'm not making that in retirement. There are some things that you can do to address that, and we can help with that. Those are the savings programs that are available, and those are the income. Is that me? No. All right. These are there are 5 different Medicare savings programs, and there's some income limits that are associated to them. You do not, for all of them, you do not have to be on Medicare or Medi-Cal to qualify. So I did not see anybody on the line that was actually on Medi-Cal, but these next couple of slides are related to that. Now, I am going to, in this last 5 minutes, I'm going to talk about the thing that's most related to Medicare right now as it associates, as it's related to the pandemic. So because we all have been so focused on either TV and not so much radio, but there's so much fraud happening right now that folks are becoming subject to phone calls that are just, nonstop, and then also the TV ads. There's about $60 billion in fraud happening every year. The best way to alleviate and to spare yourself from Medicare fraud is, once you are on Medicare, right, regardless if it's original or Medicare Advantage, you will receive a summary notice. Every 3 months or every month, you'll get that summary notice, and you should review it to see what charges have been associated to your Medicare. If anything on there looks subject, you can contact us. I represent Senior Medicare Patrol, and I have been given the authority to investigate any debt or any cause or any cost that has been associated to your Medicare that you have in question. And I can submit that information to the Inspector General. They can investigate your situation. If your Medicare becomes subject to a fraud and you have nothing to do with it, you're fine. But if there's some question about whether the frauding is associated to you or someone else, unfortunately, Medicare can suspend your Medicare benefits. For how long? Who knows? So it's very important for you to be reviewing your summary notices. Attached to this PowerPoint, I've given you a whole presentation on how to protect yourself from possible Medicare fraud. And you can review that in your own leisure. So for the sake of time, I can be reached at the contact information that's in the side presentation, but also the last couple of slides talk about how you can contact us. You can probably, instead of going through each slide, Katie, you can just pop down to the last slide. So the important thing for you as a Medicare beneficiary is to utilize us as a resource. We can connect you, perfect. We can connect you to a host of resources that can help you navigate not just your Medicare, but also just things to help you through this period through our parent organization. If you would like to contact me personally, my email is down there at the bottom. You can email me, and then I can set up a one-on-one time where you and I can speak over the phone about your specific situation. Any questions at this point? Nope. All right, Katie, I'm going to turn it back over to you. Hello. Good. Oh, great. Thank you. Thank you.
Thank you so much. Thank you, Carolyn, for all of that really amazing information. And like I mentioned, in case you missed it at the beginning, I will be sharing an email shortly, probably early next week, just so I can put a link to the recording in the email, but I will send a copy of the PowerPoint and a flyer about HICAP services so that you'll have all of the contact information that you need so that you can keep the conversation going if you have further questions or need to talk to Carolyn or to one of their amazing volunteers there. So thank you so much for joining us for Introduction to Medicare today. And a big thank you to Carolyn. We really appreciate it. For more information about our health literacy initiatives, ballot box locations, and upcoming virtual programs, just go to www.saclibrary.org. And for the Sacramento Public Library, for Carolyn and myself, thank you so much and be well. Bye.
Bye.
Bye. Thank you.